Hi, I'm your other Dr. Phil, and welcome to the Weekly Health Minute on this gorgeous sunny afternoon. I couldn't resist to be outside today. I want to speak to you about the better your nutrition, the better the quality of your body. There are 5 main problem areas that I'm going to be delving into over the next few weeks, so today we'll concentrate on the first one, the question of meat in our diets. The key things we need to look at are the key characteristics of our eating and our digestive systems, and then we can see what animals we match up with and what they eat. The key indicators that we'll look at are the teeth, the stomach, and the length of the digestive tract. The question is, are we carnivores, omnivores, herbivores, or something you may not have heard of before, the frugavores? Yes, the fruit and the nut eaters. These are animals like the monkeys and the gorillas, and we definitely have a lot in common with the monkeys and the gorillas. For example, all of our teeth are nearly the same height, and our canines are a little bit projected, and our molars are flat, and they're broad-topped. This allows us that lateral mobility for chewing. The bowel of the frugavore is about 10 to 12 times the length of our body, from our mouth to our anus. This is just like us. Again, the stomach of the frugavore is typically long and extended and is quite complex. It has about 1/10 the acidic salts and pepsin that you'll see in carnivores and omnivores. Again, just like human beings. So it looks like we have a match. What does it mean? Are we restricted to fruit and nuts only? No way. Luckily, we most resemble an animal like the chimpanzee, and they periodically eat meat and hunt as well. The difference is they only eat meat within about 3% of their daily diet, unlike the typical American diet, which is far, far, far more. Does this mean we all have to become vegetarian? Luckily, not at all. In fact, many people, depending on their blood types, need meat in their diets. The key is to keep the meat to about 3 ounces a day or less. This heavy consumption of the meats can definitely compromise the beneficial bacteria in our colon, and it also pushes us into the acidic range in our pH, which opens us up to disease and illness. That's not what I want. And studies at Harvard also report that men who eat meat as a main dish 4 or more times a week have 4 times the risk of colon cancer and twice the risk of prostate cancer. So if you're going to eat meat, buy organic and avoid the exposure to the whole range of chemicals, growth hormones, and parasites that you find in beef and chicken, and the high levels of toxic metals present in the fish. If it's not available locally, definitely pressure your local grocery store to carry it. Now, I'm going to enjoy some nuts and fruit here. This should do it for today. Next week, I'm going to expand on the dairy in our diet. And again, I'm your other Dr. Phil. I urge you to have a great week until we meet again. Bye now.